Step 1, let's free the tissues, reduce the tone in those muscles, improve your range of motion and desensitize your wrist or elbow. So here we're going to look at doing soft tissue release to help with the wrist and elbow. So here we're looking to stretch the wrist extensor, so on that lateral outside part of the forearm. So we're going to start by extending the wrist. So we're shortening the tissue. Now, using your thumb, lock into that tissue at the wrist and flex your wrist to stretch. Lock and stretch. So this will give you a much deeper stretch as well as some manual stimulation to the area that we're targeting here. So here's a close-up. You're locking in towards the elbow and stretch. Lock and stretch and work your way up towards the elbow. So we're looking to stretch the whole way through those muscle bellies. Now, as you come towards the elbow, you want to avoid those last 1 to 2 inches, the tendinous area. We don't want to aggravate any inflamed tendons. And now there are many muscles on the forearm here. So take 2 or 3 different lines, starting at the wrist, working towards the elbow. Flex, lock, stretch. Lock and stretch. Simple but effective way to reduce the tone and improve the range of motion at your wrist. Now, let's also look at rotation, so pronation and supination of the forearm. So the difference here, you're going to lock not towards the elbow but back towards yourself and simply rotate the forearm. So here trying to separate, improve how those muscles work together. Lock towards you, rotate away. Lock towards you, rotate away. Again, as we come up towards the elbow, avoiding that last 1 to 2 inches. Don't aggravate any tendons. We're aiming to soften the muscle belly here. And again, take 2 or 3 lines between the elbow and the wrist. Lock, rotate, and release. If you find you're slipping on your skin, just work through a thin towel, even through your t-shirt or shirt. That will help you get a good lock. Now remember, this should not be painful. The lock should be firm, but not painful. It should allow you to stretch, but it shouldn't be aggravating tissue. So it should feel like a really good stretch. So let's summarize. Start by extending your wrist upwards. Lock into the tissue at a 45-degree angle. We're not looking to crush muscle into bone. So that 45-degree angle is teasing the tissue up towards the elbow. Remember, it should be a pain-free pressure. It should feel firm and it should feel like a good stretch, not painful. Then once you have good lock, you want to flex or stretch your wrist downwards for 3 to 4 seconds and simply release. And you're going to work your way up from the wrist towards the elbow, working through all of that muscle tissue. Repeat that process through 2, 3, 4 different lines across the muscles of the forearm, or for 5 to 10 minutes until the tissue feels softer, feels easier to move. Don't forget, add that rotational movement and work daily until the pain eases. The wrist is notoriously difficult to stretch, so feel free to add this in as part of your maintenance or aftercare work after you've trained.